Let's get started. Welcome, everybody. Can we go to the next slide, please? All right. Let's get all of the bullets. Thanks. Welcome, everyone. My name is Urmimala Sarkar. I'm a professor of medicine here at UCSF, primary care physician, and a researcher in social media and public health. I'm really delighted to be hosting the PRISM Symposium with our friends at Hope Lab and our many sponsors for the 5th year in a row. This is just going to give you a very brief introduction to what we're doing and why we're here. But first, we're going to start with a land acknowledgement, if I can have the next slide. And put it up, please. Okay. This land acknowledgement was created by the UCSF Department of Surgery. Before we begin, we would like to acknowledge the Ramaytush Ohlone people who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. Next slide, please. Okay. All right. So this has been a very difficult year. And the question has been posed to me of why we would bother to do this conference when it has traditionally been an in-person, intimate exchange of ideas that has forged new collaborations and given people things to think about. And the reason that I really still wanted to do this year was for two reasons. First, social media, we know, is a critical force in public health discourse. And in all public discourse, really. And I believe the work that all of you do is more important than ever in the midst of a pandemic and a very difficult time politically, and that your participation as scholars, academics, and truth seekers really matters. Finally, this conference is fun, and it's not as much fun on Zoom because we can't have a cup of coffee or a glass of wine together. But hopefully intellectual exchange and collaboration will still sustain you as it does me during this difficult time. Next slide, please. Okay, so this, one of our steering committee members, Mike Diner, made this search, and we've been showing this slide for a couple of years so that you can see how much social media and public health research has accelerated over the last 15 years. Next slide. Okay, so we're here to foster social media research that improves public health. The goal is to engage with key real-world challenges in doing this work. We're going to have a frank discussion, and my goal is that participants will leave with concrete ideas about what to do what you need to know to do the work well. We want this conference to spark new ideas for you, and we want this to foster collaborations. Next slide, please. Okay, so this is just a little bit about what people here are doing. So these are results from 2018 and 2019 about social media, what social media platforms, data, and methods do you use the most for your social media research? And if you can type your response for this question into the chat box, we'll show you the word cloud for your responses for 2020 at the end of the day today. Let's keep going while the answers keep coming in. Please go back, Marika. Please go back. Okay, so that's this. Please go back one more. All right, we're trying to go to the second box, second set of word clouds. This is the third. Okay, that's the first. Go to the next slide, please. All right, so this question, what is the next frontier for social media research, hasn't actually changed that much. Interventions, behavior, access, engagement, misinformation, and this shows the breadth of what all of you are studying. Next set. All right, let's keep going, Marika. So I would love to hear people's responses in the chat to this too. What kind of social media research collaborators do you wish you could connect with more? And this is your chance. In these next 2 days, we have all of these kinds of people. We have content experts, we have machine learning experts, we have platform experts, statisticians, computer scientists, physicians, all kinds of behavioral scientists. Everyone is represented, and this is a really great place for you to find those collaborators that you're looking for. All right, so the charge for today is to please join the conversation. The Zoom webinar format doesn't allow us to see you, so we hope we will see you in the poster and networking sessions where we're going to have real conversations about this work. Whenever you do have the opportunity to be on video, please do show yourself. It is, as we all know, after 9 months of being on Zoom all the time, it is so much easier to have a conversation with another face, even if it is over a screen. Please reach out. This is still a small meeting. And even though you can't look around the room and say, oh, that person looks friendly, I'll go ask them about their area. You can absolutely chat to a panelist or fellow participant. We have staff on all of our, who will be in all of the breakout rooms, in all of the sessions, who can help you facilitate a connection if you would like one. Please do join the networking sessions and wander virtually around the poster sessions. We're using a platform called Mural. I promise you, it is the easiest virtual platform that you haven't heard of to use. Finally, tweet using the hashtag PRISMHealth2020. There will be virtual friendly prizes for the best tweets of today and tomorrow. All right, with that, I think we can move to our, of course, we have to thank our sponsors. First of all, Hope Lab is our partner in this, and we absolutely could not put this conference on without them. And we also have a number of sponsors from across the UCSF campus who are listed here. As always, we thank them, and we thank all of you. Next slide, please. All right, so we have a terrific steering committee, an amazing staff and volunteers. Thank you in advance for all that you're going to do over the next 2 days. All right, so let's get started. Here is our agenda. And I have not delayed it, thank goodness. So in 10 minutes, or just right now, we are going to start our first panel, which is updates in social media research, data sources and considerations. And this panel is going to be moderated by my UCSF friend and colleague, Meredith Meacham. She will introduce herself and we'll get started on the panel. Thank you so much.